So hello and welcome to Wednesday Weekly, your bite-sized briefing webinar, a collaboration between Action Together, the voluntary community and faith sector and the public sector. It's my pleasure to welcome you to this episode of our Cost of Living Crisis Series. Action Together are working with Oldham Council to welcome you every Wednesday between now and April to hear from the services and organisations that are working alongside you in Oldham, delivering critical help to support residents through the cost of living crisis. So before we start, just a little bit of housekeeping. Please can I ask that you keep your microphones on mute whilst our guest presenters are speaking. Say hi and introduce yourself in the chat. And as always, following the guest speakers, we'll have an opportunity at the end for questions. If any do spring to mind during the input from the speakers, please pop them in the chat and I'll bring you in when the presentation's concluded. And just a final bit of housekeeping, we are recording today's webinar and it will be edited down and available on YouTube and on Oldham Council's e-learning platform. If you would prefer not to be recorded, please keep your camera off. So without further ado, I'm really pleased to hand you over to Sarah, who will be taking us from here. Over to you, Sarah.
Thank you. So I'm Sarah Crome, the Housing Options Services Manager. And I manage the frontline housing options services from an operational aspect. Let's do the next slide, please.
It's just a bit of a delay for some reason.
Thank you. So Housing Options is made up of three key service areas. These services were brought back in-house in July 2019. So for the council, they're relatively new, but they are an existing statutory function set down by central government and have been in Oldham for a lot longer than the time it's been back in-house. The three service areas are made up of the housing register and allocations. So this is the council's statutory function to hold a housing register. We operate a choice-based letting system. So all the housing providers, all the social housing providers in Oldham advertise their properties that are available via the council's platform and allocate for households from the council's housing register. It's also known as the Common Allocations Framework Partnership. Bit snappy that. The other part of the service is the homelessness team. We provide, again, statutory function of providing housing advice, homeless prevention and assessment. So any household that is struggling due to the cost of living crisis, landlords putting up the rents, landlords are serving notice, they're struggling within the homes because they can't afford the home because they're in a big house and they're struggling to keep it warm. We will be able to provide them with advice and assistance. We do take presentations for homelessness. We will do our utmost to try and prevent that homeless situation. This can be from just negotiation. So if it's somebody losing accommodation with family, we'll do our best to negotiate the fact that person stays with the family. It could be a younger person, mum's had enough, fed up of the parties every weekend and has asked that person to leave. We'll negotiate with mum to try and have that person back. We'll have strong conversations with that person about what's acceptable and what isn't, and we'll try and build the relationship there. If mum is absolutely adamant, no, that person isn't going to stay with her, then we will try and negotiate with mum for the person to stay a wee while longer whilst we look at other housing options available to them. But at the end of the day, if that household member doesn't have anywhere to stay, we will be then looking to see if what duties under the homelessness legislation the council has for that person. I think it's wise to note that it's the government's legislation, this, it isn't council policy. And sometimes that gets lost in translation, that there's an old adage, oh, if you're homeless, the council have to house you. Sadly, that isn't the case. What we will try and do is avoid being in that situation, but ultimately the council may not have any legal duties towards you. This legislation sits under the Homelessness Reduction Act of 2017, the Housing Act of 1996, Part 6 and Part 7. And I think there's some legislation going back to the 1985 Housing Act as well. So if anybody wants bedtime reading, have a look at those, but they are quite intense. There are 5 steps with homelessness that we explore. The first one is eligibility, and that's if somebody has recourse to public funds. So are they an EU national that has got settlement status? Are they somebody who's come from the wider economic countries? Can they get benefits? Basically, if they can, they're eligible. We then look at whether the homeless, and this is where we do the prevention work to try and stop that from happening. If we can't stop that from happening, we then look at whether they have a priority need or not. So households with children under the age of 16 have got a priority need. Households who have got some medical conditions may have a priority need, and there's other criteria as well, but most of them are subjective. So I could have a diagnosis of epilepsy. I haven't had a seizure for 5 years. It's totally controlled by medication, but a person next to me could have the same diagnosis, but it's not controlled. I wouldn't be priority need, whereas that person would be. So it's very, very subjective, that, and a lot of people challenge us on that when we say they're not priority need. We also look at whether that person has done something that's resulted them in losing the home. So whether there was a consequence to their action or inaction. Did they pay the rent? If they didn't pay the rent, why not? If it's because they've kept the money and gone off on holiday to Spain and done other frivolous things with the rent money and not paid it to the landlord, it's likely we're going to say that they're intentionally homeless. If it's somebody who's had the benefits sanctioned and have not been able to claim the housing element or the housing benefit, and there's been barriers preventing them from paying, it's unlikely we will say that they're intentionally homeless. Again, very subjective and not a quick decision to be made. We look at absolutely all angles of why that person's lost the home. And then we look at if they have a local connection to the borough. And we're quite strict with this because we recognise that what limited housing we have in Oldham needs to be for Oldham residents. There are some cases who we will automatically accept into the borough if they don't have a local connection, and this is households who are fleeing domestic abuse. We've got a Greater Manchester wide agreement that if a household is fleeing domestic abuse and they present to whichever local authority, we won't apply the local connection rule. So residents of Oldham who want to flee the area will be accepted by local authorities within Greater Manchester and vice versa. Other categories, if you don't have a local connection, then I'm really sorry, we won't be assisting you, as in providing you with a home. We will be referring you back to the local authority where your connection is. And that can be anywhere within the country. We will we've sent people back to Surrey, Devon, Newcastle. But that's because we don't want, it's not that we don't want to help, we've got to protect that valuable resource of homes in the borough for our residents. And then the 5th step is what duty do we owe you? So that's when we say, yes, we're going to give you your own home, and the local authority will help that customer to secure their own home. What we're finding these days, I've alluded to the council having a housing register, and we allocating properties through there. And in a moment, you'll see a slide with some stark numbers on there. What we're having to do more and more is utilise the private sector. And in my career, I have never promoted the private sector as much as I do now. And some people may remember way back in the day in the 70s and 80s where the old big Victorian properties were converted into bedsits. They're called HMOs, housing of multiple occupancy. We're seeing a trend of going back to that, but please be assured that the standards are far better than what they were in the years gone by. They're all en-suite facilities. There's no shared bathrooms and things like that. So it has modernised despite us going back full circle. So we are having to use private sector more. And households who sadly we can't keep them in their home for whatever reason will have to go into our third service area, which is temporary accommodation. We don't want people in temporary accommodation. It's not great. There are standards in there, but we know for that person's mental health, for that stability, for routine with children, for accessing support, it's not great. But we're really, really limited and have to use what we've got available for us. So we do use hotel accommodation. Unfortunately, there is government guidelines that households with children do not extend a stay of more than 6 weeks in a hotel accommodation. To date, touch wood, Oldham are achieving that target by working really hard behind the scenes of moving people on and into their own homes and freeing up other temporary accommodation. If that was to happen, if we were to go over that target, the ministry would be on us and be investigating what's going on and looking at what measures we're putting in place to prevent that from happening. So it's something we strive to avoid because we don't want a visit from the ministry. But more importantly, we don't want our families in hotel accommodation for any longer than necessary. So we do look to move people around. We do have what we call dispersed properties. So these are properties that the council rent from providers, pepper potted across the borough, and we utilise that accommodation as well. It's better than a hotel. But again, we want that stay in that property to be as minimal as possible, because again, households are not able to set up routine. They can't plant the roots there. It is temporary accommodation. Can you go to the next slide, please, Gemma? Thank you. So the challenges we have is the lack of accommodation. General housing across the borough over the past 10 years. 10 years ago, if you approached me and said, could I have a house? I'd be saying, where would you like it? What type of front door? How big a garden? And I'd be giving you a selection of keys to choose from. Those days have gone, absolutely gone. Another challenge that we really have is the lack of adapted housing for households with disabilities. We're seeing a growth of younger age households who need a fully wheelchair adapted property. We don't have the supply available for those. We have a lot of accommodation that falls under our 55 plus shelter schemes that accommodate wheelchairs. But somebody in the 20s doesn't want to live in that community. They want to be in their own communities. So we do struggle to support households that way. We're seeing a massive increase in demand for accommodation, particularly larger families. It's really scary, the number of families that are growing, that are needing 4, 5, 6, 7 bedroom properties, and we just don't have them available. We've not had a 5-bedroom property become available since July 2021. So that's nearly 2 years. And we've got households who desperately need a property that size, and we're just not getting it. As I mentioned, increasing demand for adapted accommodation for younger people. The affordability of private rented, whilst I've said that we're reliant on that market area more and more these days, the cost of living crisis has seen a massive increase in rents. Whether it's greed, whether it's landlords putting it up, the rent up so they can afford to continue living how they do in their own homes, I can't say, but the rents have shot up. For example, the local housing allowance is for a 2-bedroom property in Oldham is £450 a month. We're seeing 2-bedroom houses being advertised by private landlords for £900 or more. We actually saw one that was at £1,050 a month for a 2-bedroom property. So it's just not affordable. Somebody on benefits wouldn't be able to claim the full rent for that. They would only be allocated £450. So they've got a massive shortfall straight away. And obviously people residing in private rented and the landlords looking to increase those rents, again, are going to be put in the same position. And we also have unknown demand. Things happen in the world that impact housing. So we never know how many former asylum seekers are going to approach the local authority. In the past 12 months, just over, we've been supporting the Ukrainian families who fled Ukraine when the war started and took advantage of the amazing host family placements, but they're coming to an end. So we're trying to predict how many of those families are going to want to come through the social housing route, or whether they're just going to go through the private rented market. So, and we just don't know when things like this are going to happen. We usually get notification from central government of a scheme and we have to respond. But what we never get is the additional bricks and mortar, sadly, because it just doesn't exist. So I spoke about the demand, and the data here is about the households on the council's housing register, and I put this in just to give you a flavour to see how the numbers have grown each year. And these are the only households that have been accepted onto the register. The council's allocation scheme changed in 2019, where we only have the 4 bands, band 1 being the highest, so that's somebody in urgent need. So it could be somebody homeless in temporary accommodation, it could be somebody in hospital bed blocking, and then down to band 4. We used to have a category, you may recall, or you may have heard of it, first come, first served. So that was for households who lived in a 3-bedroom house, didn't need to downsize, weren't overcrowded, just wanted to move. No medical need to move, just fancied a change. We've took that category out. These households here are households who have a housing need, who need to move to either a larger or a smaller home. And as you can see, the numbers have gone up significantly over the past couple of years. Next slide, please, Gemma. And again, I've spoke about the availability of properties. As you can see from there, we get a fair number of 1-bedroom properties. That's quite a transient community. So a lot of households start off in a 1-bedroom and then need larger properties, so the turnover there is higher. And there's also a lot of age restricted properties that become available, so that these are your housing 21s for the over 55 to over 60s. Again, that's quite a transient community because the households from there tend to move on into extra care housing where there's more support, or to residential care. So the turnover in that stock is slightly higher. But then, as you see, the bigger the property, the smaller the numbers, and we're just not getting them through at all. For the 6-bedroom properties, I think there's actually 6 buildings in the borough that have 6 bedrooms, so it is very stark. I want to go to the next page because they're quite sad. So this is just to give you an idea of the number of people that we're seeing through the homelessness and temporary accommodation teams. I've broken it down by quarter. I've put Q4, obviously for 2023, this was Q3's number, so apologies, but I just thought to give you an idea. We've not even finished the full year yet for statistics, and we're already seeing there but 300 more than we did last year, and the numbers speak for themselves. To be fair, in 2020, through the initial first lockdown, the numbers did reduce slightly in the very first lockdown, but then as that the pandemic progressed, the numbers started to pick up again, and obviously the cost of living there. Just go back a screen, please, Gemma. And the bottom screen there shows the number of households that we're accommodating in temporary accommodation. And as you can see, those numbers are just, again, going up and up and up. Barriers for moving households out as speedily as we would like is the lack of accommodation available. Next screen. Thank you. So after the pandemic, Access Oldham reopened the front doors, which took us by surprise, to be honest. And that wasn't the initial plan. The services had a restructure based on we weren't having the front door. So we planned other ways of how we would reach out to our vulnerable customers. Predominantly everything is online and digital. But we do know that there are pockets of our community that are really vulnerable and don't get access to the digital services. So the structure was developed to be able to deliver that. In April, we saw 147 people the whole month through the door. Since April to February, that number, as you can see, has increased, and in February we saw 1,543 people through the door coming in looking for help and support. So we're really seeing the impact of the cost of living crisis. We're really seeing people struggling, whether that's to stay within family members, and that's breaking down because of the pressures that it's costing to run a home, or affordability, but we're definitely seeing an increase in customers coming our way, which is quite sad. And I'm really sorry to finish on quite a Debbie Downer there, but that's some facts and figures of our service. So any questions?
Thanks, Sarah.
Hi, Sarah. I haven't got any questions, but wow, what are you up against? I cannot believe them figures. Yeah. And for yourself, if you've been in that service for a long time, how you've seen that change, it must be so upsetting for you, because you can't, you physically, and there's nothing to help them people, and yeah, it's stressful.
No, you are absolutely right, because it's everything goes full circle, doesn't it, over time, and only when you become older and wiser that you recognise that. But I remember back in 2010, there was 20 households in temporary accommodation in Oldham.
Yeah, they changed now. Oh God,
and
yes,
and now that's just, at the moment, that's just a dream, and it is soul destroying. And the upsetting thing is it's these families and children are having to be in this position, and that's the bit that gets us.
Yeah. And it's the price of the rent, isn't it? The rent price is so high, and then some of the accommodation aren't really
£1,000 for a 2-bedroom house in Oldham is just ridiculous.
They're
London prices. You know, for donkey's years, we've mocked London and the ridiculous prices, but literally over the past 2-3 years, we've seen the private sector prices shooting up in the borough to just extortionate.
Yeah, it's so hard.
Scary.
Yeah, thank you. Yeah.
Does anybody have any questions for Sarah? No?
Thanks, Sarah. Sorry. Thanks, Sarah, for that. Was really interesting. I know I asked a similar question on a meeting before, and I know with the presentation you've just given about Access Oldham, obviously the unplanned, unexpected opening of the front door. And I know you were saying that there sort of maybe changes to that to sort of support more vulnerable clients that can't access things digitally.
Yeah,
So,
I should have said our ambition and what we're working towards is having availability of staff to deal with people who come into Access Oldham, but we want to be in a position where we're out in the localities, place-based working, so we're integrating with the teams and the networks that are already out in the communities, so we can try and do more prevention work. So we can get these cases before it escalates and they turn up at the door. And we want to be also going out to people in the homes. We're acutely aware we've got an aging population that don't have access to anything digital, and we really do need to get to those households as well. So that's what we're working towards, but we just need to reduce or dial down the footfall coming through for our services in Access Oldham to be able to facilitate that.
Yeah, no, that's great. Good to hear as well. There's plans in the pipeline.
Oh, definitely.
Super. Thanks.
Thanks, Natalie.